Today we're discussing the digestive tract. Why do we eat? Why is this important? We need food. Where does the food go? Inside our mouth. The mouth is very important because we have to separate it between what? The trachea and the what? Esophagus. This is an important procedure that is held together by the simple process of the epiglottis closing. If it closes, food can easily slide down. If it does not close, we can aspirate and go into what? The food goes into the lung. We definitely don't want that. This is space above it is called the pharynx in general. As it goes down, this small sphincter has to open, and it's called the upper esophageal sphincter. This is also what has to open in order for us to vomit or regurgitate. We go into the stomach. Well, there's another sphincter that we all have problems with, or most patients will have, and you must be very familiar with, the lower esophageal sphincter. This is where the sphincter gets weakened, and we have acid reflux that what? Hydrochloric acid comes out up into the esophagus. The important thing to remember is that the esophagus is not the same material, cellular material, as the stomach. It does not have bicarbonate secretions that can offset the hydrochloric acid. So acid reflux is a very serious problem because you can create what? Ulcers around what? The LES and right down here on the bottom of the esophagus. As food comes in, we churn. Churn why? Because we put in fats, proteins, carbohydrates, and the body's going to separate it. As we separate it, we do not do what? We do very little digestion in the stomach. It is all done what? The stomach is the grinder, and the small intestine is the digester, or the absorption area. The best thing to think about a digestion is absorption. Absorption of what? Nutrients. And the pancreas and the gallbladder help us do that. And the most important thing the pancreas is going to do is release digestive enzymes. Now we need to know these digestive enzymes. That is amylase, lipase, and let's see, where else? Oh, pepsin, excuse me. And we'll come down here. There's the pepsin. Protein digestion for pepsin. Lipase is for fat. Amylase is for sugars. So we have three things. What do we get from food? We get fats, proteins, and carbohydrates. The most important thing here is that we have three digestive enzymes that we must know. Lipase is for fat, obvious. Amylase is for sugar, and pepsin is for proteins. So where do they get released? They get released where? Right here from our friend the pancreas. And why do we release them from the pancreas? Because we need what? We need these enzymes to help us absorb where? In the small intestine. So let's not get into the cell wall of the small intestine just yet. Let's go backwards up to what is so special about the stomach wall. It has mucus cells. Why? To produce mucus secretion so we can what? We can provide what? A barrier for the hydrochloric acid and the food to churn and churn and churn and churn and churn for hours on end. Then we have the parietal cell. That is an important cell that actually tells all the other cells of the stomach lining how to work. So think of the parietal cell as the boss. The mucus cell is obvious. The chief cell does what? Its main option is to produce pepsin, protein digestion. Why would we have this pepsin production in the stomach? We're not really digesting the protein. We're taking time to break down the protein so when it gets into the small intestine, we can actually absorb it. We want to what? Tenderize the meat. The chief cells, are producing the pepsin. The G cells are producing gastrin. What is gastrin? Gastrin is what? Hydrochloric acid, basically, to help us what? Break down food. And meaning break down, we're not digesting it, we're churning and churning for hours on end. And so what's the main thing that we need to know is the parietal cell. The parietal cell is where all our major medications react to slow down or change the stomach acid in our stomach, not to be redundant. So what does Ranitidine do? It literally stops the histamine reaction. So when the stomach is churning and it's producing what? It gets a histamine signal because it needs to break down what? More food. It goes right here and says, oh, I'm going to block this histamine reaction so the parietal cell will not tell us to produce what? More hydrochloric acid. Here you can see acetylcholine receptor. That's going to be for the muscle of what? The muscle 3 receptor of the stomach. So that's going to tell the muscle lining of the stomach to work. So if we block the acetylcholine receptor, we're going to do what? Slow down the stomach's action. Same thing with gastrin. We're not going to produce this gastric acid if we block it. Mainly there's some drugs that are in general do this as a side effect. The prostaglandin reaction is more due to action of the activity of the stomach. So we have misoprostol, which what? Slows down the stomach acid and produces more mucus. So that would be great for what? Stomach acids, right? I mean stomach ulcers rather. So this is very important. Ranitidine does what? It's a histamine blocker. It's an H2 blocker, and it slows down what? The production of stomach acid in what? The gastrin cell. Remember, the parietal cell is the boss. Then we have the proton pump inhibitors, omeprazole. What do? They stop the potassium going in and out of the parietal cell so the muscle can work or not work or what? Produce gastric acid. Meaning they stop the pump to produce what? Gastric acid, which is hydrochloric acid. This is very important. Remember, gastric acid, the more we produce, the lower the stomach acid goes, the pH, and the more we can break down food. However, there's an inherent problem. We have to balance that with the mucus cell to offset. We also have some bicarbonate production in the stomach, but this is not nearly as important because we're worried about what? How antacids would slow down the hydrogen atom. The hydrogen atom is part of the hydrogen chloride combination. So the bottom line is we need to know antacids work here on the what? Parietal cell. The proton pump inhibitors, omeprazole, and all the rest, they work where? On the parietal cell. Ranitidine, which is Zantac, works where? On the parietal cell. The same thing. Everything that you will find that works on the stomach works on the parietal cell in general. So the important thing is, now we know how the stomach wall works. Now we're getting into the small intestine. The small intestine, its job is to do what? To absorb material. So we need to understand the cells of the small intestine. We have the villi, which is the brush border, which carries what? Food along this little line here, and we can what? We have the absorptive cells and the goblet cells. Mainly you have to understand that what's inside this lining of cells. There's a capillary and lymph. Lymph absorb all the fat from the lipase, and we absorb what? Fat through the lymph. And the capillaries take care of what? The sugar and the proteins. So in general, you have to remember the absorptive cells, okay, and the goblet cells, and that we have villi, what? To move the food particles along with some of the peristaltic motion of the intestine, to move the food along. So, oh, here's a piece, we can absorb it here, we'll put it into the lymph. Oh no, it's sugar, we'll put it into the bloodstream. And this is how we absorb food quite readily. But it takes what? Hours to get out of the stomach, then to absorb into the small intestine. So what happens, or what is the main concern, is if we have too much stomach activity or too much what? Hydrochloric acid, we're going to create a what? Duodenal ulcer, a small intestine ulcer, which is obviously much more difficult to treat. So why are we worried? We need to make sure we don't overeat and put what kind of pressure on the pancreas. Because the pancreas is going to produce this one little thing right here that's very important, bicarbonate. Bicarbonate offsets what? The hydrochloric acid. And that is from the S cells in the pancreas. The S cells, we have alpha, beta, delta. We have S cells in the pancreas. We have I cells. We have D cells. We just said K cells. So the I cells produce what? CCK, which increases the pancreatic function and the gallbladder to release what? Bile. Bile comes out of the gallbladder to help us do what? Break down fat. So CCK is going to be elevated for what? When we digest a lot of fat. The D cells do what? They mess with our insulin and glucagon. So are they important? Of course. When we're taking in a lot more sugar, we're going to be paying attention as to how these cells react. The K cells, it's the GIP and the VIP. They decrease hydrogen and increase insulin. Well, that would be important if we're taking in a lot of sugar. The VIP cells, they increase the intestine, how we deal with the electrolyte absorption. So this is very important. If our body is saying, hey, I'm low in potassium or I'm low in sodium, I'm going to produce VIP. So mainly we have all kinds of cells that do all kinds of things where? In the pancreas. The pancreas is very important because it's a gland that gives us all these different types of enzymes to help us do what? This food is food. We have to turn this food into particles that we can then get past this wall, the intestinal wall, the small intestine, and get into what? The capillaries, and then be absorbed into what? Our blood system. So it's very important. There's some issues that we have to worry about. Intrinsic factor, which is secreted by the parietal cell, that attaches to B12 so we can absorb the B12 in our small intestine. If we do not produce intrinsic factor, we will have what? Macrocytic anemia, meaning that we do not have the proper RBC development based upon what? The B12 not being there. So we're going to do it by what? We're then going to have to compensate and use an IM injection of cyanocobalamin or B12 to offset this lack of intrinsic factor. Again, what are we mainly concerned about here at this process with the pancreas is how we absorb the food. So if the food is sitting here for too long we're taking in large meals, we're going to be putting what? The pancreas under stress. The other thing that we have to worry about is this pyloric sphincter. That is the one that controls and lets the food out into the small intestine. We have to know the difference, that the pyloric sphincter is at the bottom of the stomach and the lower esophageal sphincter is at the top. So acid reflux happens here, and what can happen here? Early dumping situations, premature dumping. So if we are under stress a lot, we'll dump food too quickly. Then we have to produce what? A lot of secretin to do what? Bicarbonate to offset. We cannot have, remember the small intestine is not a stomach. It doesn't have a bunch of mucus cells as we talked about over here. So it cannot do what? Handle the hydrochloric acid. We have to neutralize the hydrochloric acid right here, and then we have to absorb the food right here. So we have what? 3 digestive enzymes that you must know. Lipase for fats, amylase for sugars, and pepsin for protein. After that, it would be good to know about the GIP and the VIP, and the fact that we can turn the gallbladder on. It stores the bile to help us digest what? More fats. The important thing is to remember in review that the parietal cell in the stomach is where all the action happens, and we must know what the parietal cell does at all times. That's how we're going to treat stomach problems. As for the digestive problems, if we're slow in digestive, we can try and use what? Digestive enzymes. We're going to monitor amylase and lipase, and they're going to be elevated, severely elevated in pancreatitis. That's due to what? Too many digestive enzymes being secreted due to irritants such as alcohol. So you must be familiar with lipase and amylase in particular because they're always going to be monitored with any digestive absorptive problem because we have to take in food where? In the small intestine. So in summation, please remember the digestive enzymes. Why do we produce them? Secretin is very important. Lipase, GIP, VIP, CCK. Why are these all important? So we can break down and absorb these nutrients into the small intestine and the vascular system that's lying underneath. Please review this and understand it as well as you can, and send me any questions if you have any concerns. Thank you.